Hi, hello, welcome back. So today we are with a second question for UAE guidelines related interview questions for medical coders. So before entering into the video, if you haven't subscribed my channel, please do subscribe, and if you find it useful, please do share it with your friends also. So in this, we are going to watch the second question. Already I told you, totally we have planned for 30 questions. So the second question is, explain the difference between ICD-10-CM, CPT and HCPCS and how they are used in UAE. So when you are hearing this question, it sounds similar or little bit easy also, but there are few things which you have to add when you are answering this question. Let's enter like the three coding system, that is ICD-10, CPT and HCPCS, are essential for medical coding worldwide, including UAE. Each serves a distinct purpose in the healthcare system. So you can see the abbreviated form of ICD, CPT and HCPCS, which is given below. Please make a note of it and keep. So the next slide will detailedly explain the purpose and usage. So ICD-10 purposes, it classifies disease symptoms and healthcare conditions, and usage is, we use this in both inpatient and outpatient setting, and healthcare providers in UAE must follow the ICD-10-CM guidelines for submitting accurate insurance claim, ensuring proper reimbursement and compliance with the local authorities. When coming to CPT, it includes categories for evaluation, surgeries, radiology, pathology and other treatment. Usage, the codes are vital for billing purpose, and insurance companies in UAE require CPT codes for accurate processing claims. Hospitals and clinics submit CPT codes for services like surgery, diagnostic test and physician consultation. When coming to HCPCS, it is used to code medical supplies, durable equipment, medications, etc. And usage is, so HCPCS level 2 codes are particularly important for submitting claims for medical equipment and medications like CPT codes. HCPCS codes are also required for insurance claim submissions. So in UAE, all three category systems are integrated into healthcare billing practice and claim submission processes, with compliance overseen by local authorities DHA, HAD and MOHAP. Coder must use the system appropriately to ensure accurate claim and proper reimbursement from the insurers. So that's all. And finally, if you are looking for medical coding training as well as interview guidance, you can just mail me or just WhatsApp me in this given number. Thank you so much for watching, and if you are preparing for your interview, please make a note of all the series and keep, and you can refresh it, like when you are preparing you can go through this content also. Thank you so much for watching. If you haven't subscribed, please do subscribe and share it with your friends, those who are searching job in UAE. Thank you so much. Take care. Wish you all the best.